Are your headaches going away?
The ones I think that were caused by the tumor are, but now they've been replaced by the radiation therapy headaches.
Yeah.
So,
and the shaking of the hand?
well, I haven't had any incidents of shaking or spasms at all.
I understand that before you developed this present headache, you had previously been seen by your family doctor for sinus headaches, is that right?
Yes.
How many years had he been treating you for sinus headaches?
Well, my file is pretty thick at this doctor's office, but his partner had seen me for 5 years probably at least for allergy problems and sinus headaches and things like that. So he also this particular doctor had seen me for 2 years, but I've probably got 7 to 10 years worth of allergy files in the office.
Okay. This is the MRI of Kenneth. It was done on September 25th, 2001. The MRI of the brain is very abnormal. You can see a large tumor in the right hemisphere. To orient you, this is the front of the brain, this is the back of the brain, this is the right side, this is the left side. So this tumor involves the front of the right hemisphere. We can see a central area of necrosis, and there is surrounding edema, the white area around the tumor. You can also see that the brain is shifted from right to left, and the pointer shows that part of the brain that has crossed the midline. You also notice that there's no ventricle. The right lateral ventricle is totally obliterated, and the left lateral ventricle is also not well seen. This next picture is Kenneth's MRI of the brain following contrast. In fact, the tumor only enhanced minimally where the pointer is. The rest of the grayness is the cerebral edema. This MRI shows that the right hemisphere is pushed over to the left hemisphere, and you can see the side of the right hemisphere here. You do not see the right lateral ventricle. You do not see the left lateral ventricle. This MRI demonstrates minimal enhancement in the presence of a very large tumor. Kenneth is another example of a secondary headache disorder. When initially seen, he had no other symptoms other than the headaches, but later developed left hand contractions and urinary incontinence. These are focal neurological findings, and both of these would indicate that we are dealing with a secondary headache disorder. When a patient presents like this, an MRI or CAT scan of the brain is indicated. Many patients present with acute headaches. If head trauma, blood, or subarachnoid hemorrhage is suspected, a CAT scan of the brain should be done immediately. All other disorders of the brain are usually diagnosed with an MRI. If trying to differentiate a posterior fossa lesion from other conditions, an MRI of the brain should be done rather than a CAT scan because of artifacts associated with CAT scans of the posterior fossa.